Hi, today we'd like to continue on our PCOS series discussing its treatment and also effective diagnosis at Antai Hospital. So Antai Hospital do offers a very highly effective surgical approach to treat the underlying root cause for PCOS, which is presence of these abnormal testicular tissues causing all the symptoms that we know of PCOS, and also the abnormally high testosterone, and also why these women tend to observe either infertility or miscarriages. It's all due to the root cause of this abnormal testicular tissue, which is why surgery is the most effective way. And Antai Hospital does offer that for its patients with a success rate up to 95%. So patients do get in touch with us if you are interested. So in this video, we'd like to talk about the conventional treatment of PCOS, the most widely used PCOS, and why it's not exactly the most effective way, but it does have its own purposes. So the most common approach anywhere in the world, if you go for your general doctor or any gynecologist, they will prescribe you the oral contraceptives, some form of contraceptives, as a treatment for this PCOS that you are suffering from. The most common one being Diane 35. Now, contraceptives are basically just a combination of estrogen and progesterone, although there's much more progesterone inside it. And when consumed regularly as prescribed by a doctor, you will see that you do begin to menstruate, which is we can't really call it menstruation because there is no ovulation. Patients who have PCOS will not menstruate regularly. There is no ovulation. So what you see, what the menses that you do observe is simply the shedding of the inner lining. There is no egg cell within. It's artificial menstruation. But especially parents of young patients, PCOS, and also those in their 20s, when they do see that they are regularly bleeding again after taking these medications, they do feel a sense of relief, some form of psychological consolation. They believe that, they might be getting better because I used to not bleed and used to not menstruate regularly. Now I'm menstruating again on this medication. That must mean that this medication is effective, but that is in fact not the case. Furthermore, patients also further believe that this medication is effective is because it does alleviate symptoms of PCOS because of the estrogen and progesterone. It can bring down the testosterone because of your PCOS. You do observe high testosterone, so being regularly on this medication, oral contraceptives, it can bring down the testosterone level. So symptoms that we associate with PCOS, the excessive body hair, the excessive acne, all of these symptoms do tend to go away on this medication, which is why a lot of patients prefer to go for this route instead of the most effective approach, which is surgery. Not only do you need to regularly be on this medication, you tend to gain a dependence on this medication, and maybe over time we do see that patients no longer ovulate anymore, even after dropping the medications, because your body has gained some form of dependence on the medication. So at that point, surgical approach is inevitable. So why it's not that effective is because you are still not ovulating. It does not solve your ovulation problem, and furthermore, it only alleviates symptoms. Not only can you not ovulate, you cannot get pregnant, and even if you do get pregnant, you will still observe a miscarriage because oral contraceptives, unfortunately, although they are very convenient and although they can alleviate symptoms, they cannot bring you pregnancy, cannot bring you healthy, normal ovulation because they only deal with the symptoms. As we have described in our previous videos, the effective treatment is that we need to remove the root cause, which is the presence of these abnormal testicular tissue within the ovaries. That is the only way that you can observe not only your symptoms going away without any medication, you can also attain healthy pregnancies, and no miscarriages will happen during these pregnancies. That is the only way, and this treatment needs only be done one time, one effective treatment, one surgery, and you will have a lifelong of no symptoms and no more PCOS. That is why it's so crucial that you realize the stark difference. You can still choose to be on this medication if you have no intentions to get pregnant or start a family. But if you do have these intentions, which most women do, then you need to go for surgical approach. So we tend to prescribe oral contraceptives, Diane 35, to patients who are slightly younger, who are not ready to go for surgery, especially those in their adolescent years, in their schooling years. So for women in their 20s, in their 30s, who are intending to go for marriage, intending to go for pregnancy, this is the only approach that you should take. And if you do still rely on these contraceptives, it is a lifelong journey, and know that you will not be able to ovulate normally, and also you will not see a healthy pregnancy. If you do see a healthy pregnancy, it could be a high risk pregnancy as well. So we want to avoid that. And Antai Hospital, as I've mentioned, we do offer this highly effective one-time surgery. This surgery is minimally invasive, and it does not cause any scarring, and it can lead to all these healthy fertility goals that you intend to achieve in your pregnancy, in your marriage, in your later years. And also it can return the quality of life that you want, the symptoms alleviating. So there's no more acne, there's no more excessive body hair, the obesity, the insulin resistance, all of it will alleviate after the surgery. So do get in touch with us via the website, and also read our articles on PCOS. Learn about all the symptoms and why surgery is the most effective approach. If you want a temporary approach, then you should go for the contraceptive. If you do want to menstruate regularly and attain healthy pregnancy, surgery to remove these abnormal tissues is the most effective approach.